Receptor alpha-2 adrenergic receptor. Location: presynaptic nerve terminals. Salivary glands. Main effects: inhibits insulin secretion from the pancreas, inhibits norepinephrine release from presynaptic terminals, inhibits salivary gland secretion. Clinical relevance: alpha-2 agonists, like clonidine, reduce sympathetic outflow and lower blood pressure, can also cause dry mouth and bradycardia. USMLE style questions. Question: a hypertensive patient is prescribed clonidine. Which of the following best describes the mechanism by which this drug lowers blood pressure? A. Beta-1 receptor blockade in the heart. B. Alpha-1 receptor blockade in vascular smooth muscle. C. Alpha-2 receptor agonism at presynaptic terminals. Beta-2 receptor stimulation in vascular smooth muscle. E. Muscarinic receptor antagonism. Correct answer C. Alpha-2 receptor agonism at presynaptic terminals. Explanation: clonidine is an alpha-2 agonist that works centrally by stimulating presynaptic alpha-2 receptors, which inhibit norepinephrine release, reducing sympathetic tone and lowering blood pressure. Why not the others? A. Beta blockers like metoprolol act here, not clonidine. B. Alpha-1 blockers like prazosin relax vessels but are different drugs. D. Beta-2 stimulation causes vasodilation but is not the mechanism of clonidine. E. Muscarinic receptors are part of the parasympathetic system. Question 2. Which of the following physiological effects is most likely due to activation of alpha-2 adrenergic receptors? A. Increased insulin secretion. B. Increased norepinephrine release. C. Increased salivary secretion. D. Inhibition of insulin secretion. E. Bronchodilation. Correct answer: D. Inhibition of insulin secretion. Explanation: alpha-2 receptors in the pancreas inhibit insulin secretion. This helps conserve glucose during sympathetic activation, fight or flight response. Why not the others? A. Beta-2 receptors stimulate insulin release. B. Alpha-2 inhibits norepinephrine release, negative feedback. C. Salivary secretion is reduced, not increased, by alpha-2 activation. E. Bronchodilation is a beta-2 effect, not alpha-2. Would you like